It's nice that you're here, interested to hear about our technology. I'm going to tell you this afternoon about how we will cure immune diseases with sugar. We have developed a glyco-immunology treatment for which we received the Spinoza Award, and the Spinoza Award is the highest scientific award in the Netherlands. And this is our Chief Scientific Officer, Professor Yvette van Kooik, very proud, carrying a sugar molecule in her hand. So we are developing, next, right? Oh, sorry. Yep. So as I said, we are developing immunotherapy based on sugar technology, glycotechnology. And you are looking at an investment market which is really large, a very unique opportunity because our technology will serve 50% of the community in allergy alone, because our technology can be used for autoimmune diseases, but also for oncology and also for allergy. So allergy alone is already a 50% market, which is a 10 billion market. So it's a big market that we are tackling. And it's a market that really needs a more effective cure. And we have that promise that we will change the way that allergy is treated. We have a strong patent position and a seasoned management team dedicated and very passionate to bring a cure for allergy, autoimmune diseases, and oncology. So this is our leadership team. As you can see, we have a team that is very well versed in building companies and also building pipelines, as well as a very good scientific background. Our chief medical officer is a medical doctor, immunologist, and Yvette van Kooik is, of course, the godmother of our technology. And we have a very strong advisory board, all key opinion leaders in the field. We are a spin-off company of Amsterdam University, and you see to your left, you see our lab building. We have already invested 7.5 million in our technology, and we now have achieved proof of concept, and we really need to set up our own facilities. We need to expand our team and also upscale our production. So therefore, we need an additional 5 million over the next 5 years. Having said that, we expect that our first immune therapy will go to clinic within the next 3 years. So in the next 5 years, we expect a revenue stream of 10 million. We are the one company that loves our competition. And the reason is that we can improve their technology, their own immune therapy. If you look at the allergy field, there are some specialty companies focusing on allergy only. And they are bringing to market long-course treatments that where you have to take an injection every month for 3 to 5 years. So it's a very high burden to patients. And only patients with very severe allergy will take that option. So we are now talking to 7 of the companies that are listed here to see how we can improve their technology. And we are already working with Allergo Pharma for our first proof of concept. As I said, it's a large market. 1.3 billion people suffer now from allergy, and we expect the market to triple in the next 10 years. Now only very severe patients take immunotherapy, but 30% of people currently having allergy are not satisfied with their treatment. So the potential market is that we are looking for is 10 billion. And how do we know that? Already 50% of the school children suffer from one or more allergies. So in 10 years' time, we are looking at a real epidemic. And with very severe consequences like asthma, COPD. And as I said, the treatment options are not very favorable, so there's a real need for innovation, and that is where our glycoimmunotherapy comes in. So here is our award-winning immunotherapy, and this is how it works. As you know, all our cells are covered with glycans, very complex sugars, and that is important for the communication between the cells. Yvette discovered that that dendritic cells have specific lectin receptors that bind specifically to certain glycans. And there are lectin receptors that bind to glycans that can stimulate the immune response via the dendritic cell, or, on the other hand, other glycans can induce tolerance. And this is the basis of our technology. So here you can see on the top, the DC sign is a stimulator for the immune response. It will bind to the Lewis Y glycan, and it will increase the internalization, and will stimulate CD4 as well as CD8 T cell response. And therefore you get a much stronger immune response, and also a much longer immune response. On the other hand, we have the cyclic receptor, which binds to sialic acid, and when that is internalized, that gives an increase of Tregs and a tolerance response, and it will block the T cell response. So that gives a tolerance effect, which we can use for allergy, but also autoimmune diseases. So this is the basis of our technology, where we bind a glycan to an antigen, and that can either be a peptide or a full protein or a liposome. It can be a lipid strength as well. And if we use liposomes, we can put in the antigens in the liposome and then glycate the liposome. And the combination between the specific glycan and the antigen is the basis of our technology. So we can apply our technology to enhance cancer immunotherapy, but we can also repair autoimmune disorder, and we can also look at allergy. And we decided to look at allergy 4 years ago because in allergy the antigens are very well defined. So we have a very easy target to look into. So we looked into allergy, and what we did was we worked with Allergopharma, Merck, on this project. We took the peptide from Merck, glycated that to sialic acid, and then offered that to the dendritic cells. And what you see in an animal model like the allergic asthma SCID model is that when you sensitize the mice, you give them the vaccine, the glycated vaccine, and challenge them again. And then we look at the tolerance induction. We see that the glycated peptide, which is on the right, if you compare that to the naked peptide from Merck, you see a much higher tolerance induction and a reduced inflammation in the lungs. This is also the case if you look in an in vitro human model where we are looking at donor PBMCs, both from allergic patients as well as from non-allergic patients. You see an increase of Tregs and a blockage of the Th1, Th2, and Th22 with the whole cytokine profiles attached to it. So this is the basis of, we looked of course in many other aspects of this, but this is the basis of our proof of concept, where we have shown that our allergics, our glycated immune vaccines are much more potent. They provide a short treatment because they target directly the dendritic cells. They are safe because the amount of allergen can be much lower than originally. And also they will give a lifelong protection. So our business model is, we are a platform company, so our business model is one of co-development and licensing. So after we have proof of concept, we expect to out-license our technology to our partner in return for milestones and royalties. And we can do that for multiple allergens and antigens. So this is where we are right now. We almost completed our preclinical package for grass pollen allergics, grass pollen glycated peptides. We are now looking into house dust mite, peanut, fish allergy, and also biologics. Apparently, some people create some allergic reactions to their biologic treatment. And so we are going to look into whether we can reduce that by glycating the biologics, and we are going to look into factor VIII early next year. And in addition, we are still continuing with our program in transplantation. We start a program in rheumatology, in MS, and also oncology. So as I said, it can also, glycation can also enhance cancer immunotherapy. It's a different pathway, a different glycan receptor. It induces the CD4 and CD8 response. And what we are doing, we are using lipopeptides that are conjugated with glycans, and we either bind that to the tumor antigen or we insert it into a tumor cell as a target for the dendritic cell. We are also looking at the environment, the microenvironment of tumor cells, because of, as you may know, the microenvironment, the glycans in the microenvironment of tumor cells change when the cell gets tumorous. Autoimmune diseases, we are looking at rheumatology, we are looking at MS, and what we want to achieve is to decrease the inflammation and repair the autoimmunity by looking at the self antigens. We have a strong patent both for immune stimulation as well as immune tolerance, and it's a method patent, so it can be we will be able to expand that on a composition of matter patent for each indication or each antigen. So this is our technology, and I hope that you will support us to find a cure, not only for allergy, but also for serious autoimmune diseases and cancer. And here are my contact details, so I look forward to receiving the call. Thank you.